Welcome to this week's video. Today's topic is postural orthostatic tachycardia syndrome. Y'all know I have terrible luck, so of course I have this condition along with many others. Since life has granted me with so many conditions, it has unfortunately forced me to be an unwilling expert on the matter. Doctors actually frequently compliment me on my knowledge and treatment management. That brings us to today's matter. Things people with POTS don't talk about. POTS is an acronym for postural orthostatic tachycardia syndrome, most notably categorized by an increase in heart rate when moving from a laying or sitting position into standing. It can cause a variety of symptoms, including nausea, dizziness, chest pain, headaches, and some bad cases of fainting. There is definitely more, but those are the most notable. POTS has been known by many names throughout our history. Some examples of POTS' older names are mitral valve prolapse, chronic orthostatic intolerance, and soldier's heart. Honestly, soldier's heart is such a cooler name. Like, imagine having that in your chart, because I feel like I would be cooler, but no. Instead, we are stuck with the name POTS, an acronym we can't use with friends and family because they think it means you smoke weed. Or at least that's how it is for me because I live in rural Maine, so maybe it's not like that for everyone, I don't know. The name POTS came into existence in 1993. POTS was previously thought to be an anxiety disorder, but in 1993, when POTS got its name, that it still has today, it was discovered to be an autonomic nervous system disorder by the Mayo Clinic. However, the stigma surrounding POTS as just an anxiety disorder still lingers around today. POTS is diagnosed in two ways, either this medieval-looking test called the tilt table test, or through a version doctors call the poor man's tilt table test. This is how I have been diagnosed multiple times in two different states. Yep, I'm what they call a medical mess. Anyway, a tilt table is used to diagnose the cause of unknown fainting. The patient lays flat on a table, and the doctor straps the patient down with belts to hold them in place. Then the doctor places sticky pads on you, also known as electrodes, to monitor your heart. A blood pressure cuff is placed on the patient, as well as an oxygen monitor, which is placed on your finger. Sometimes drugs are administered through an IV to provoke the symptoms by lowering your already low blood pressure if you have POTS. Then you lay flat for 5 minutes after the table moves like a freaking roller coaster, so the patient will be in a standing position. The doctors will monitor the patient's symptoms and be there if you faint. Boom! Diagnosis after some good old-fashioned medical trauma you can add to your repertoire. The poor man's tilt table test is way less traumatic. It involves not getting IV drugs. The doctor places a blood pressure cuff on your arm and monitors your heart rate. First, the patient lays flat for 5 to 10 minutes, and the doctor records the baseline. Then the patient will attempt to stand for 10 minutes without fainting. The doctor will measure their blood pressure periodically starting at 1 minute, then at 3 minutes, next at 5, then at 7, and lastly at 10 minutes. If the patient's heart raises above 30 beats per minute while standing, that indicates the patient has POTS. It is commonly mistaken as a heart condition given the word tachycardia. However, it is actually an autonomic nervous system disorder. Your vagus nerve is supposed to balance your heart rate and blood pressure no matter what position you are in. If you have POTS, your brain and body can't regulate the constriction of your blood vessels, so when you stand, the blood vessels stay in your feet instead of flowing to your brain. Your brain is very smart. It knows when no blood is getting to it. Your brain corrects the lack of blood flow by making you collapse to the ground, aka makes you flat. Once you're flat on the ground, the blood can reach your brain easier due to gravity. Once the blood is back into your brain, boom, you regain consciousness. Since POTS is a nervous system disorder, you think a neurologist / a brain doctor would manage the patient's treatment? Nope, doesn't happen. Cardiologists are still the ones patients are sent to by their primary care doctor and is the standard of care. Patients often get stuck in a loop of each specialist saying they cannot help them, it's not their area of expertise, and sending them to yet another specialist. So they're just getting passed around to each doctor, and they're like, I can't do nothing for you. It's very annoying. POTS is not curable, but it can be managed or go into remission. The first course of action is lifestyle changes like high fluid intake, 2/3 liters of water or any fluid, high salt intake, 3,000 to 10,000 milligrams of salt, or in grams 25, recommended by Cleveland Clinic. In order to retain all the water you're required to drink instead of peeing it out, you need lots of salt so your body holds on to it. That's why you have to eat that much salt. Abdominal compression garments, reducing blood pooling by keeping it near the heart, making it easier for your heart to send blood back to your brain. Light exercise like swimming, and shower chairs to prevent fainting in the shower due to warm water, which can cause blood pooling. Funnily enough, my doctor says I have a prescription for junk food since I need so much salt in Gatorade, and they're kind of accurate. If these steps do not work, there are medications that can be added to the treatment plan. There is no medication specifically dedicated to POTS, but there are many medications that were made for one condition but just so happen to help others. Most commonly used off-label medications for POTS are fludrocortisone, which I probably messed that up. It's a fancy name, okay? This is actually the medication I take for my POTS. It works by increasing salt retention and blood volume. It's working great for me. I haven't fainted in 3 months. That's probably a record for me. Though I am worried for summer, which always makes it worse. My apologies for how bad I'm going to butcher this medication name. It's pyridostigmine, which may reduce tachycardia. Midodrine. That's funny because I literally was on that medicine and still can't pronounce it. Causes widespread vasoconstriction. Vasoconstriction is basically your muscles tightening so the blood flows. People without POTS experience vasoconstriction when it's cold outside. The muscles tighten to keep blood flowing to keep you warm. This medication personally did not work for me at all. It gave me frequent migraines and made me faint more. My cardiologist says it's my fault it doesn't work because I can't drink enough water, and in order for the medication to work, you need to drink water. The medication needs proper hydration to work because it only constricts the blood vessels. It doesn't increase the blood volume, which water does. Every medication works differently for everybody, but my experience on this one was not good. Next is beta blockers, which may reduce upright tachycardia. Some examples of beta blockers are propranolol, metoprolol, atenolol, and bisoprolol. Why do medication names have to be so hard to pronounce? Can't even pronounce right. Great. This class of medication also gave me migraines. I have no idea, especially when this medication works miracles for my sister who also has POTS. Why does it not work for me? We have the same genes. But as I said, medicine works different for everyone. POTS can be caused by a variety of reasons. Some individuals don't even know why they have it. In those cases, it is labeled as idiopathic. I personally hate that medical term because why am I getting labeled the idiot in my medical chart? My dad likes to say the idiopathic one is the doctor, which is funny, but in my personal experience, doctors will treat you like it's your fault. That's all besides the point, though. The most common causes are onset POTS after viral bacterial infections, like COVID-19, which is part of the reason why cases of POTS are rising, even though POTS was already common disorder. According to dysautonomiainternational.org, prior to the COVID-19 pandemic, POTS was estimated to impact 1 to 3 million Americans and millions of other people around the world. Experts estimate that the POTS population has doubled since the start of COVID-19 pandemic. Physical trauma like concussions can also cause POTS, which is ironic because POTS can cause fainting, which can cause concussions. So, you're just going to make your POTS times 2. It does not cancel out. I can tell you that for sure because I've had 4 concussions, which always freaks my doctors out because each concussion is a risk for making POTS worse, as well as putting you at risk for a bunch of other things. Another cause of POTS is pregnancy or puberty due to the flood of hormones in your body messing with your nervous system. When POTS is caused for this reason, it usually is not permanent and can go into remission, though sometimes it sticks around, unfortunately. Autoimmune conditions are known to cause POTS as well due to their body constantly attacking theirself. Their nervous system obviously gets effed in the process. This is another reason why POTS is on the rise, because autoimmune disorders are also on the rise due to our rapid changing freaking environment. If the rich could stop destroying it, that would be great. I saved the worst one for last, deconditioning. I actually don't know anyone who has POTS due to deconditioning, yet it's the most talked about reason and what doctors always bring up. Deconditioning is rapid decline in physical function caused by inactivity or bed rest. Due to deconditioning being the most talked about reason for POTS, it can be a very stigmatizing diagnosis, leading people who know nothing about you instantly assuming you have POTS because you are quote unquote lazy or not trying hard enough. I have ran into my fair share of doctors who think this way as well. However, this is far from the truth. Many athletes have developed POTS while being at peak health. Most notable case is American Olympian swimmer Katie Ledecky, who still has POTS, but manages it with medication and continues to compete. You can be at peak health and still have POTS and have it affect you. I mean, who is in more shape than a literal Olympian? Being physically active won't cure your POTS, but it can improve symptoms. People with POTS are not lazy. They are living with a heart doing twice the work of a person without POTS. It's no wonder they're tired with a heart rate that looks like they just ran a marathon, yet they're just standing up. POTS is different for everyone who has it, and varies in severity for each person. Some people with POTS can continue daily tasks like school and work with minimal symptoms. On the other hand, there are people with POTS who are on disability due to working being dangerous for them. Employers obviously don't want someone who frequently faints on the job. If you have POTS, you are unfortunately seen as a liability by a lot of people. I'm speaking from experience, unfortunately. According to dysautonomianational.org, approximately 25% of POTS patients are disabled and unable to work. Dysautonomianational.org also states researchers have found that quality of life in POTS patients is comparable to patients on dialysis for kidney failure. Wow, that is not a hopeful sentence. There is something that doctors don't tell you when you get diagnosed with POTS. It is only standing that triggers POTS. That's what you think when you first get diagnosed with it, but that is far from the case. It's not as simple as eating salt and drinking water like most doctors tell you to do. Of course it helps symptoms. Doctors don't make up random stuff for fun. You have to figure out what triggers POTS for yourself. The nervous system controls everything, and POTS controls your nervous system. It's kind of embarrassing what triggers POTS, so of course people don't want to talk about it, but I feel doctors should bring it up. I mean, there is the obvious that triggers it that doctors do bring up, like exercise and heavy meals, because it's a lot of work on your body to digest and control your heart rate at the same time. Some things I think doctors should mention, though, other than that, when you get diagnosed with POTS. I'll give you a comprehensive list of them. It's extremely dangerous if you get constipated. I mean, it's dangerous if they get constipated for everyone, because it can lead to things like bowel blockages and impactions. We all definitely should be prioritizing fiber instead of protein like all the gym bros are doing. We should be focusing on that fiber. But that's besides the point. If you strain too much while going to the bathroom, you can faint. That goes for people without POTS as well. You engage your nervous system when doing a bowel movement. However, for people with POTS, their system is already hyperactive, so even lightly being constipated can lead to dangerous situations like fainting and falling off the toilet. You don't want to do that, and you don't want to be seen in that position. So it's very important to up your fiber intake if you can, and if you can't, get on some laxatives. It's gross, but it's true. I'd rather take a laxative than be caught fainting on a toilet with my pants down. That would just be embarrassing. Okay. Showers are the most likely place you will faint and the most dangerous place to faint. Not only is it embarrassing being found on the shower floor naked and unconscious, I like to tell my doctor it's like that show, Naked and Afraid. They did not like that joke. Anyway, it's incredibly dangerous. You run a high risk of getting a concussion or cracking your head open on the faucet. Shower chairs should be instantly recommended to POTS patients. Showering doesn't just run the risk of fainting. If the water is too hot or even lukewarm, the nausea will hit you like a whirlwind tornado. Hot water can cause blood pooling in your feet, even in people without POTS. This is especially dangerous to people with POTS because it increases a problem they already deal with. They may not faint but get nauseous and vomit. However, you still have to shower. Using shower chairs are the safest option. I have been told to buy a shower chair to reduce my risk of getting another concussion. I still haven't done that though. I definitely need to work on my internalized ableism. I just don't want to feel like I'm giving up. However, I think a lot of people with chronic illness share the same feelings of pushing themselves past their limit, so I wanted to bring it up, of my feelings. We all know POTS causes an increase in heart rate while moving from sitting to standing, but why would we expect lifting to trigger POTS? It's not like we're moving from sitting to standing, we're already standing. It's that good old overactive nervous system again. When lifting, blood pools to your feet, and people without POTS. However, their body easily pumps their blood back to their heart. It's more difficult for your body to do that with POTS due to the lower blood volume you already have. By the way, when I say lifting, I am not meaning weights. I mean anything, like lifting a jug of milk can even cause symptoms of dizziness, nausea, and fainting. Lucky for me, I don't drink milk. That's a little joke, sorry. I was trying to lighten the mood. It does help to build up tolerance to lifting. Cardiologists have never been a big help to me, but physical therapists are great and way more helpful. I had one who told me I didn't even need to buy weights, just use soup cans. They are the same as 5-pound weights, which will probably be my max of weight because I already have Ehlers-Danlos syndrome. So it's different again for everyone. If you just have POTS, you can definitely lift more than 5 pounds. However, being able to lift 5 pounds is incredibly helpful. So thank you, physical therapist. You rule. You are overlooked for POTS treatment. I think you should be sent to physical therapy pretty much immediately if you have POTS. Just saying. It's really helpful to learn how to faint correctly by squatting. You're less likely to get a concussion. Shout out. I would say your name, physical therapist, but I'm not going to, because I think you retired. One thing I wanted to mention, I almost forgot it until I was editing, and I feel it's very important. They don't warn you, if you go on an airplane, your POTS is gonna flare up insanely. So I went on a 6-hour flight to LA once, and dude, I fainted almost like immediately after getting off this airplane, and my mom was dragging me around. I don't have a wheelchair because I'm fine with forearm crutches right now for my Ehlers-Danlos, and I never thought I'd need a wheelchair for my POTS. I might need a wheelchair as Ehlers-Danlos gets more progressive as I age, but I didn't get a wheelchair for the airport because I didn't know that sitting in an airplane for so long up in the air would affect me. I mean, I guess it should be self-explanatory. Even people without POTS wear compression socks so they don't get blood clots in their legs. Girl, if you have POTS, you're already at risk for blood pooling, and even people without POTS are blood pooling on the plane. So, dude, it's super dangerous to fly if you don't wear compression socks or compression garment. And I didn't wear it, okay? Because I didn't think, nobody said anything. How was I to know? I got diagnosed when I was like 16, so I just thought it would be fine. I'm 23, I could go on a plane. Apparently not, so definitely look out if you have plans to go on a plane if you have POTS, okay? That is all I have to say about POTS today, but please don't hesitate to comment if I missed something or you want to leave your own words of wisdom. I always highly appreciate it. Most importantly, everyone, stay weird. If you want to read more about POTS from scientific researchers, check out the description down below for educational links. Bye!